The gap between what is standard and what is optimal is huge.
It sounds almost as if I know from the coaching experience, whenever we try to work alongside clinicians and really optimize people, like that gap between getting them okay and optimal, like that's like the missing portion of it. And that's where so many people live so often and they have no idea how good it can be because it's so normalized nowadays.
I think that if anything, that gap is more pronounced, or at least I see it more often, right? I see so many cases of incomplete rehab and processes that even if it is good rehab could be more efficient or less burdensome to the client or the patient. The gap between what is standard and what is optimal is huge. Standard is limited by so many different things, therapist constraints. And insurance is one of the biggest problems. I mean, if we're being so honest, insurance really limits how much attention a therapist can give. So even some really great therapists aren't able to provide the best quality care that they could if they had a different system in place, if they weren't wrapped into billing constraints or productivity standards. And so, like, that's the first battle that has to be overcome, I think, with the majority of clinics, because most people want to pay with their insurance.